Addressing education and care gaps in tracheostomy management, insights from a multi-stakeholder global survey from the Global Tracheostomy Collaborative. That's what I want to continue talking about today in this video. My name is Patrick Hutzel from intensivecareathome.com, and in this week's blog I want to talk about this study again. This is the third part of this series where I talk about this study. It's a long study. It's a good study overall, so thanks to the Global Tracheostomy Collaborative. But especially when it comes to community care, I don't think they have the study has all the answers, or they were even asking the right questions. So I really want to break this study down and talk about the study and also what solutions we have here at Intensive Care at Home, especially when it comes to community nursing for tracheostomy clients, whether it's adults or children. So I have done 2 videos about it already, talking about the purpose of the survey, and I've also introduced the survey, and I'll link to my previous videos to this study in the written version of this blog. Today I want to actually talk about the results of the study and the participant characteristics. So the study included 170 participants from diverse professional roles, demographics and global locations, reflecting the multidisciplinary nature of tracheostomy care. The largest professional groups were speech-language pathologists, nurses, respiratory care practitioners, physicians, surgeons. Other roles included patients, family members, caregivers, and hospital administrators, social workers. Among physicians, surgeons, specialties were anesthesiologists, intensivists, otolaryngologists, interventional pulmonologists, and general practitioners. Most participants were aged 41 to 65 years, followed by 21 to 40 years, and over 65 years. Gender distribution showed 82% female, 16% male, and 2% non-binary respondents. Geographically, participants represented 14 countries across 6 continents, with the majority from the United States, United Kingdom, Australia, Canada, and India. The remaining 7% were from Israel, New Zealand, Brazil, Germany, Indonesia, Italy, Puerto Rico, South Africa, and Spain. All survey responses were complete and with no exclusions for missing data. Obviously, I'll put a link in the written version of this blog to the study. Let's look at the challenges with tracheostomy care based on severity scores. Respondents rated the importance of various aspects of tracheostomy care on a scale from 0, not a problem at all, to 10, severe problems. The most pressing concern identified was the limited availability of healthcare professionals with specialized tracheostomy expertise, which received a median rating of 8. This concern was closely followed by access issues for patients in remote areas with a median score of 7. Affordability also emerged as a significant concern with a median score of 6, specifically highlighting costs associated with extended hospital stays and ventilator-associated pneumonias, also known as VAP. Now, the answer that Intensive Care at Home has for all of that is, we don't have a limited availability of healthcare professionals with specialized tracheostomy expertise, because Intensive Care at Home is exclusively working with critical care nurses with a minimum of 2 years critical care nursing experience. Obviously, all of our staff are ventilation and tracheostomy competent, right? Which enables us to employ hundreds of years of critical care nursing experience combined, right? I argue no other provider brings a higher skill level into the community than Intensive Care at Home, right? Also, what the survey also has not mentioned in one word is evidence-based. We provide evidence-based services, which means if you look on our website at intensivecareathome.com, you will find a section called the Mechanical Home Ventilation Guidelines. The Mechanical Home Ventilation Guidelines are a evidence-based piece of document that has come out of over 25 years of intensive care at home nursing in Germany, and also come out of intensive care at home nursing in Australia since 2012. And the Mechanical Home Ventilation Guidelines clearly say that exclusively critical care nurses with a minimum of 2 years critical care nursing experience, ideally with a postgraduate critical care qualification, can safely provide services at home for ventilation and tracheostomy clients. Nothing less than that. That is the gold standard. And at no point has this survey here addressed the gold standard, whereas we are addressing the gold standard. Also, let's look at the limited availability of healthcare professionals in remote areas. Again, we service remote areas here in Australia. It's very challenging. I'm not saying it's an easy part of our service, but it is definitely doable to serve remote areas as well. And affordability, well, it is way more affordable to pay for intensive care at home than it is to pay for a hospital, let alone for an ICU bed where most tracheostomy patients are. So, you know, maybe the Global Tracheostomy Collaborative hasn't really quite understood what's actually happening in the real world with a provider like ours, who actually makes it affordable for, you know, for funding bodies, for healthcare funding bodies. So then the survey continues here. Participants also expressed concerns about challenges related to adverse events and the lack of patient-centered care, particularly in suctioning and stoma maintenance. Suctioning issues such as discomfort, aspiration, bleeding, and ventilator-associated pneumonia risk were the highest rated concerns, with a median severity level of 6. Stoma care and tracheostomy tube changes were identified as moderately severe challenges, each with median scores of 5. Tube changes at 7. These challenges included concerns about tube dislodgement, occlusion, false tract formation, trauma, and bleeding. Once again, those are, you know, real challenges. However, once again, this is all taken care of if you have a highly skilled workforce, and if you have a service that supports that highly skilled workforce, which is what we do here at Intensive Care at Home. You know, we have a below industry average staff turnover, and that means, you know, we have the expertise, you know, to provide that patient-centered care, what the clients and the patients and their families are looking for. And I agree that in the community, suctioning and stoma maintenance is different compared to a hospital, because we can tailor make it to the clients, how they want to be suctioned, how they want their dressings to be done. Whereas in a hospital, it's sort of one size fits all. You know, when it says suctioning issues such as discomfort, aspiration, bleeding, and VAP risks, you know, are the highest rated concerns. Again, you know, we suction our clients how they want to be suctioned, right? We change the tracheostomy dressing the way they want it to be changed, right? An aspiration risk, yes, that is real, but again, with the critical care nursing workforce in the community, that is most of the time better managed than if people are left without critical care nurses and are most likely dying, because that is what's happening. And the same, you know, tube dislodgement, occlusion, false tract formation, trauma, and bleeding. Once again, you need a highly skilled workforce to manage those issues to begin with. So in the next video, we will talk about challenges, specific tracheostomy, suctioning, tube changes, stomach care, and devices. That's where we continue in the next video. So with Intensive Care at Home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. We are providing the following: home care services for ventilated adults and children with tracheostomies with critical care nurses 24 hours a day. A genuine alternative to a long-term stay in intensive care or long-term acute care. We're providing tracheostomy care, home care services for patients on non-invasive ventilation, such as home BiPAP, home CPAP. We're providing services for home TPN, also known as total parenteral nutrition, which is also known as IV nutrition. Also, home IV potassium and home IV magnesium infusions, IV fluids, and IV antibiotics. We're providing central line management, peak line management, Hickman's line management, as well as port management at home. We're providing nasogastric tube and PEG tube management at home, cough assist machines for our clients for airway clearance at home, palliative care services at home, as well as ventilator weaning at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to an emergency department. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day. And we're freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life is much improved surrounded by families instead of staying in an intensive care unit. With intensive care at home, we're currently operating all around Australia in all major capital cities, as well as in all regional and rural areas. We are an NDIS approved service provider all around Australia, TAC and WorkSafe in Victoria, DVA, Department of Veteran Affairs all around Australia. Our clients and we as a service provider have also received funding through public hospitals, private health funds, as well as departments of health. We are currently the only service provider in Australia that has achieved third-party accreditation for intensive care home nursing in 2025. We have been achieving this level of accreditation since 2012. No other provider in Australia has created more intellectual property when it comes to intensive care home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. If you are at home already and you're watching this, or you're stuck in an ICU, or if you're going to hospital and ED all the time and you realize that you don't have the right level of support at home, or if you're living in an ICU, I'll give you a very tangible and real-world example today. One of our first clients, when we first got started in 2012, was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are not equipped to look after a ventilated and tracheostomy client. That is dangerous and it's negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with a cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at risk of dying if they don't have a team of critical care nurses looking after them 24/7 at home. This is actually evidence-based and is documented in our mechanical home ventilation guidelines that you can find on our website at intensivecareathome.com. Think about it, in an intensive care unit in a hospital, you wouldn't have support workers looking after your critically ill loved one or after any critically ill patient on a ventilator with a tracheostomy. So why would anyone in their right mind would do that in a home care environment in the community? So this client found out about us eventually, and the ICU that he went back to all the time also knew about us and eventually reached out to us, and we were proving our concept with this client very fast. When we worked with this particular client, we sent him intensive care nurses 24 hours a day, and he never ever went back into ICU ever again, as long as we were working with this client. We can do the same for you if you're not safe at home, and help you with keeping you at home predictably. Otherwise, we wouldn't be in business. The same is applicable for those stuck in an ICU, similar to this case study that I've given you. Or if you're going back to ED all the time, please reach out to us. We can help you with taking you through the right steps, including how to get funding with different funding bodies. This is also why we are providing level 2 and level 3 NDI support coordination. We have a team of NDI support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDI support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management in Victoria. If you're an NDI support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. And if you need more evidence for nursing care, we're also writing nursing assessment, NDIS nursing assessments with legal nurse, critical care consulting nurses. And if you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, we're employing hundreds of years of critical care nursing experience combined, and you can join this high-performing team. If you're looking for a career change, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury-Wodonga, in Bendigo, in Geelong, and in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again, because they are so vulnerable and so special, and that's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency, and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts, and you're really keen on building solid relationships with us and with our clients. And if you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients, or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is so much more cost-effective than what you're paying for in ICU and ED, and you get the same level of care. If you are a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, or home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US or in the UK, and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecarehome.com. Call us on one of the numbers on the top of our website, or simply send us an email to info@intensivecarehome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next, or what questions and insights you have from this video. Thank you so much for watching. This is Patrick Hutzel from intensivecarehome.com, and I will talk to you in a few days. Take care for now.